talaga, di ba?
Yeah.
Talaga namang maraming sinabi doon si
And
Mon Tulfo.
now I think I understand from Malacanang, no, from the DOH and the FDA, there will be an investigation into Mon Tulfo's admissions. Although, yun nga, more than a month ago, may investigation na rin into...
At saka alam natin where the FDA investigations have gone so far. Sila mismo nagsasabi that even after their investigations, they keep hitting walls.
a stone wall.
No, doon din sa Malacanang.
NBI has its hands full.
Yeah.
Sa dami ng ini-investigate.
Magmula dasera hanggang sa baboy, hanggang sa ano.
Hanggang pork, hanggang
sa bakuna.
smuggled vaccines.
Okay.
Yeah.
Well, sige, let's go now to our topic. I understand we have our guests already waiting in the wings. We are now joined by Assistant Secretary Noel Reyes of the Department of Agriculture. Sir, thank you for joining us and welcome back to the Chiefs.
Yes,
Good
thank
evening,
you.
sir.
Good evening.
Hi, Luchi, hi, Roby, and kay Ana Marie.
Yes, sir.
Magandang gabi po sa inyo lahat. Good evening.
Yes, sir.
On
We're
behalf
happy.
of Secretary William Dar. And
Yes, sir. We're happy to have you on board kasi ang dami namin gustong klaruhin eh. Kasi kagabi lamang, guest namin yung Pork Producers Federation, si Nick Briones. At iba po yung kanyang figures na binibigay sa amin kumpara sa binibigay ng Agriculture Department. So, hindi po nagtutugma yung dalawa. Ito po kasi, sa huli, ang babagsakan natin ng tanong na ito. Sa 2 linggo na we've been pumping pork into Metro Manila, subsidized pa yan by taxpayers, mukhang hindi nag-work at nagbabanta pa ng panibagong welga by Friday itong pork producers. So where are we now and what's wrong? Ano talagang pinagmumulan problema?
Ed, no? Roby and Chiki. Itong natin, Luchi, yung problema natin ay talagang nag-ugat yan sa ASF. Again, inamin natin talagang kulang ang baboy sa Pilipinas, lalo na sa Metro Manila. Kasi net consumption area ito. No? Sa atin, sa taya natin, 12.9 million million hogs ang population ng 2020. Ngayong 2021, bumaba na yan, nasa 9.7. No? Malaki, no? Or 9, sabihin na natin. No? Ang laking nabawas sa population. About close to 4 million hogs.
Hogs.
So yan po, yes, 4 million hogs.
Heads po yan, heads.
Na. Heads. So, yan, out of those 4 million, kalahating million talagang directly namatay. Na cull. Tapos yung 3.5, sabihin natin, hindi na nag-alaga yung mga racers kasi for fear na ma-infect lang at pagkakasakit mo, matay. So,
okay, so
again,
we lost a quarter, bale. We lost a quarter of our usual
definitely.
supply.
Yes, mga sabi nga nila 30% pa nga ang computation. Anyway, so para maibsan yan, ngayon na lang tumaas ang presyo, no? Itong inamin natin tumaas ang presyo noong October, November, December. Pero from the usual range na 270 to 300. Kung makikita natin ang datos, talagang ngayon naman ang kalakaran noong paman 270 to 300. Andyan na yung ASF, no? Ibig sabihin, mahigit na 1 taon, ganun pa rin ang presyuhan. Ibig sabihin, yung farm gate level, hindi nagbabago. Kaya lang sumipa talaga, tumaas ang demand ng Pasko. Okay? Lechon, hamon, and all the rest, no? Ang nakakapagtaka, noong January, naiwan sa taas yung presyo, 450. Anong ibig sabihin nun? Ang laki ng kita ng mga traders at kung sino pa man, no? Sa gitna, tinatawag natin na mga nasa gitna. Siyempre, hog racers, So, naisip namin na dapat mag-impose, mag-recommend, kasi ang dami ng umiyak na consumers tayo, no? 400 to 450. Saan ka nakakita ng baboy na kasing mahal pa rin ng baka? Di ba? It's, ang laki ng kita na nasa gitna. More than twice ng farm gate level. So, we recommended a price cap of 270 to 300. So, yan nga, February 1st, February 8 natin pinatupad. And we know, para mabigyan ng supply ang Maynila, ay namasyal tayo, no? Secretary, talaga kami, pumunta ng Calabarzon para i-encourage yung mga hog racers. Tapos kinausap, magkano ba talaga dyan sa Batangas? Sabi nila, 180 to 200. Tama lang po, Secretary, kaya lang, hindi na namin mapigil yun ng pagtaas dyan sa retail kasi hindi na sila involved, no? But anyway, ganun din sa Mindanao, 140, 160 ang farm gate. Mas mura talaga sa Mindanao. And Visayas, nasa 160, 180. So again, para makaparating sa Maynila, mabilis, nagbigay tayo ng transport support na 21 pesos kada kilo kung
Yes,
manggagaling
we
sa Mindanao.
remember that.
Anong
Yeah.
ibig sabihin noon? 80 kilograms, sabihin na natin isang baboy, times 21 kilos, nasa 1,600 ang kada ulong. Parang subsidy, ayuda na yun. Di ba? Kung galing naman ng Visayas, 15 pesos, nasa 1,002 for an 80 kilogram hog. And then 10 pesos kung galing sa Luzon, that's equivalent to 800 pesos per hog. Hindi ba? Maganda na nga yun na ayuda, no? But then again, ito, napaparating natin sa Metro Manila markets, pero kulang-kulang pa rin, no? What we're saying is that tuloy-tuloy pa rin naman yan. Nasa 4,000 ang tansya namin na kinakatay bago pa nung itong price cap, no? So, tinatapatan lang natin yon. In fact, umaabot pa sa 4,500 ang average na unloading o deliveries to Metro Manila, including carcasses from Luzon, no? Kasi hindi mas mura kung talagang kinatay na yung pork in a box na iparating dito sa Metro Manila kaysa yung buhay. Okay? So yan po ang yan po ngayon ang kwentas claras.
Yeah, Mr. Reyes. Yung sinasabi nila, so malinaw yung yung we're trying to bring in more pork from Mindanao and Visayas. Pero ang sinasabi ng hog raisers, if I understood them correctly, is yung, as you said, no, kulang pa rin yung nanggagaling. Now they're saying, ipasok pa natin, we haven't gotten into it, ipasok pa natin yung discussion about importation of pork.
Yeah.
And they're saying, between importation and the price cap here in the metro, both are conspiring to basically disincentivize local hog raisers from being able to deliver more. They're saying, kaya naman namin i-deliver if it were not for the price cap, or at least if the price cap was a bit more reasonable, kaya namin i-deliver. And at the same time, the importation, they're saying, is adding to that disincentive to deliver.
Yeah, Roby, ganito yan, no? Kaya nating, sinasabi nila kaya, pero kulang talaga. So ang binabalansin natin dito, yung interest para sa consumers. Ito lang naman, 60 days lang naman ito, di ba? And then, kasi matagal mag-alaga ng baboy 4 to 6 months Kunyari, 9 million hogs ngayon. Kung mag-aalaga tayo today, ay haharvestin yan, hahanguin yung baboy 4-6 months later, di ba? So, meanwhile, magigipit tayo sa supply. Kaya, we're recommending to increase our pork imports to about 400,000 metric tons. Na yun ang taya naman ng industry, no? Tansya namin for the rest of the year. Dadating naman yan is staggered basis Hindi naman babaha ng imports What we're saying is, we need the supply now to stabilize prices.
Ang reklamo po nila ay hindi marami raw mga producer ang hindi raw po nabigyan ng anumang ayuda or nabayaran ng sapat nang mamatay ang mga alaga nilang baboy nung ASF. So hindi pa nga naman sila nakakabawi dahil nga sa napakarami talagang nawala ron. Ngayon, ang mangyayari pa, mag-i-import, tapos lower tariffs pa yung naiisip na ibigay, samantalang sila, parang napag-iwanan. So, I guess, ang tanong nga nila paano naman kami? Tapos, yun nga, nagpa-price ceiling pa, so paano nga naman sila makakabawi? Anong sagot ng gobyerno ron?
Yes, para kung paano makabawi, again, Lichi, ito na nga ang ayuda na binibigay namin. No? Yung 5,000, kasi kapos din naman, so ini-increase na ngayon, gagawin 10,000 sa insurance coverage. Okay? Indemnification of 5,000, nakapagbigay na po tayo ng 1.3 billion sa mahigit na mga kalahating milyon baboy na namatay. Okay? So, ang ayuda naman sa kanila, in this part, yung transport subsidy. And then, sa backyard raisers po, we're pouring in 500 million, 500 million for backyard raisers in green zones. Ibig sabihin, para makapag-umpisa na uli sila, mag-repopulate. Libre po yun sa backyard racers.
Marami na
Ang
bang
bibili na
nag-avail, sir? Kasi parang ang impression nga
unti-unti
namin
na lang.
is halos, ganon talaga. Kasi
Yeah,
parang
And
yung
then,
report ni Mr. Briones kagabi, konti pa lang talaga ang nakakapag-avail nun. At mas marami raw ang mga hindi na nabayaran. No? So, parang...
hindi naman totoo yun. Hindi naman totoo. We put in 1.3 billion. Siguro kung hindi pa nababayaran, siguro a few thousand na lang. Okay? So, again, yung hinihiling nila na doblehin kasi 5,000 na naliliitan sila. So, we're doing it 10,000. So, nasa insurance coverage na po yun. Inaayos na po yung guidelines at ang PCIC board ay hinihintay na lang ang desisyon ni Presidente. No? Pinopose na yan ni Secretary sa Cabinet and awaiting approval of the President. Naitaas yung coverage to 10,000, from 5,000 to 10,000. So, yun po. And then, tumulong din ngayon ang financial sector, ang Land Bank has allotted 15 billion for a loan window for commercial racers. And then DBP has likewise allotted 12 billion for commercial racers. Na, lalo na sa Visayas and Mindanao, actually, kung alam nyo lang, sa Visayas and Mindanao, karamihan dyan, nag-aalaga, yung commercial racers, nag-aalaga ng baboy for the Metro Manila market. Yan po, ayan ang katotohanan dyan. So, alam nilang pang surplus. So again, efficient po sa Mindanao ngayon kasi mandun yung corn, ang feeds, mababa ang cost ng inputs, and then power, no? Kaya ang farm gate doon, 140, 160. So, maganda.
Yeah. Sec, we have Ami Pamintuan of the Philippine Star.
Yes. Good evening, Asec.
Hi, good evening.
Merong statement ng UP Los Baños, agriculture, na kailangan, nire-recommenda nila na i-withdraw nyo na yung price cap. Saka, pinag-aaralan daw actually ito ng Agriculture Department. Kumusta na po yung balak ninyo na aagahan nyo yung pag-recall? Kasi, yung sinasabi ng mga nagtitinda na tutuloy pa daw nila yung kanilang pork holiday and chicken holiday kapag tuloy-tuloy ang price cap na yun.
Yes, yun po, nag-meeting po ang mga concerned officials kanina, and the Secretary chaired it para reviewin yung data analytics, yung farm gate level, reviewin kung ano ba talaga where we are now after the third week of implementation ng price ceiling. So again, pinakinggan po yung suggestion ni Senator Villar and the hog racers na reviewin po yun, no? Yung implementation ng price ceiling. So, and even increasing it to, kasi hinihiling naman ng mga racers, no? Sila Warren Chesterton, na taasan naman. Okay yung price ceiling, pero taasan. Gawing 330, 340 ang suggested retail price. So again, we're studying those two suggestions.
So you're open to that? Yeah. You're open to that level?
Yes, we are.
Kasi that's a substantial increase from the price cap.
Yes, about 310, 330, 340. So, pinag-aaralan po ng livestock group, field operations, and syempre, yung ating mga bantay presyo at marketing, yung agribusiness marketing group namin.
Kasi sir, ang mga nakukuha naman naming mga ulat ay yung sinusupply nyo raw from, say, Mindanao ay napupunta sa mga lugar kung saan walang pork holiday. Siyempre, doon dinadala kasi they can, diba, they can charge as much as they need. So, paano po naman yon na parang sa Metro Manila lang nagkaka-pork holiday tuloy?
Tama. Again, tinututukan namin yan kasi yung mga mag-deliver lang from Visayas, Mindanao, and other parts of Luzon to Metro Manila, dapat sila lang ang makatanggap ng subsidy. Okay, beyond that, kung may benta nila sa Tanay o sa labas, hindi sila tatanggap ng 21 pesos from Mindanao, 15, Visayas, and 10. Malaki din po yun. So, yun po ang ginagawa namin. Pinapatutukan ngayon ng Secretary. Magmula sa Mindanao, saan pupunta yan? Dapat sa bukas sa bukas. So pagdating dito, sa Mega Q-Mart ang bagsak niyan. O kaya sa Muñoz o sa Commonwealth. Hindi madadivert. Tama ka, Luchi.
Asek, in the meantime, sa lahat ng pinag-uusapan natin, this has always been the premise for this entire story, that something's broken in the value chain. Hindi natin alam kung ano. And ilang linggo nang sinasabi, hindi lang ninyo, but by so many agencies, all the way to Malacanang, iimbestigahan natin to, hanapin natin kung sinong nag-hoard, sinong nagmamanipula, and so on. Nasaan na po ba ang mga investigasyon? At saka, bakit po ba ang hirap-hirap hanapin niyang kung sino man ang kailangan managot?
Tama ka, Robbie. Next week siguro lalabas na yung listahan. Meron na pong listahan yung Bantay Presyo Task Force headed by our Assistant Secretary Federico Lasiste in partnership with DOJ and DTI. Meron po sila. About 100 data yung violators na bigyan ng notice of complaint. Yun po ang pinaka-basis na despite the price cap, nahuli sila na nagbebenta na mas mataas. No? Again, binigyan muna sila ng notice at pinapa-explain kung bakit gano'n ang presyuhan nila. So, hindi naman agad pinapasara.
Apa.
Pero hindi
Sir, yun pa
naman
nga po
to
yung...
cartel or hindi naman to sindikato. Hindi naman yan ganyan. Parang are
Tama
these
ka, Lucy.
individual
Kasi,
violators, ganon? Yeah. Yes, sir.
Nag-uusap-usap din sila. Yun ang gusto nang ipakita na talagang may pag-uusap sila kaya sama-sama silang nagtataas ng presyo.
Opo, pero sir, I think yung tanong is, kasi yung sabi nyo nga po, violators, which is, I think, a very specific term. It's also relatively neutral, if you think about it, in the context of people are expecting sindikato, manipulators, and so on. It's possible that some violators took advantage of the fact na manipulated na yung market, tumaas na. So, sasabay na rin ako dyan kung ganyan pala ang presyo, di ba? That's a violator also. Give us an idea, and I know, as you said, you will bear the details next week. But give us an idea, ano po ba yung profile nitong mga 100 violators na to? Are they enough to, as government keeps saying, to manipulate the entire pork market in the country? Are they also big enough? Or to Lucci's point, baka naman mga traders lang din to na nakisabay na sa krisis.
Tama ka. More likely, yan, mga traders and biyaheros na kasi po dalawang klase yung major na nakikita namin based doon sa aming survey. Pag galing sa Mindanao, may tatanggap sa port, yun sa pier, may isang biyahero na yon. Siya nagkapital para doon. Tapos mamaya, may isang biyahero naman from the port, dadali din sa slaughterhouse. Okay? From the slaughterhouse, dadali naman sa merkado, may biyahero number 3. So, ayan po, yung mga tatlong level, ay may kanya-kanyang karga yan. At yun po, doon kumbaga sa malalaki ang patong from that end na hindi naman dapat.
Pero Asec, I suppose dati na yung sistemang yan hindi ba? That was pre-October pa na may ganung karaming layers along the way between the farm and the marketplace. So what makes it so different now? What I want to ask really is this ang sabi nga ninyo, ang mga 100 yung mga violators, ito ba mga violators sa mga simpleng vendors lamang, retailers lamang, o ito ba yung hinahanap natin na mga talagang nagmanipula? Sabi nga ni Lucci, parang nagkartel. Kasi malaki pong pagkakaiba ng dalawang yun.
Tama ka, Ed, Kasi kami nagtataka naman, bago mag-October, bago mag-4th quarter last year, ang presyuhan 270, 300 Okay lang tumaas nung Pasko. Kaya lang hindi na bumaba muli
Opo.
Hindi naman ganun din ang pagtaas sa farm gate level. So therefore, dapat bumaba na. Therefore, lang, napakasimple na nanatiling nalasan sila na malaki ang profit margin nila, ayaw na nilang ibaba.
So what you're saying po is it's not really ASF then kasi ASF was 2019 pa. If that is the case na tumaas lamang October, di na bumaba since then. So it's not really ASF.
Yes, tama ka. Well, dyan? One word lang yan, greed.
Or mga namantala. Siguro yun na yun, no?
Yes.
Sinamantala talaga yung ASF, the shortage that
Pero
came
talaga
out
namang,
of it, no? Pero parang organized sila Parang yun na nga, no? Parang organized na sila Or patong-patong na lang ba yan? Parang dahil tinaasan na nung nung
Tama.
transport. Ito
But-
namang
but-
nagpatong na rin, no?
Pag na-interview sila, hindi ko naman sinasabi, hayaan mo naman kami makabawi, Luchi. Anong ibig sabihin ng one time, big time?
Exactly.
Ibig sabihin, may laki ng kita nila, tapos sila mismo nagsasabi, hayaan nyo naman kami makabawi kasi napilay kami. Therefore, ano ibig
So
sabihin?
nagwi-wait
Recovery
full.
of costs.
Yes.
Yes, but if
Sila
they were...
mismo,
On the back of the ASF, yes.
but I think
Sila
that's the...
mismo nagsabi na,
but-
pabira naman, tinamaan na kami, pabayaan nyo naman kayong bumawi.
pero
Kulang
yun...
din sila mga kasi sila doon di ba? Yun ang sinasabi
Tama
nila.
naman.
No? Meron silang ASF at nahihirapan sila.
Yeah.
Yung mga kilala ko naglilitson, they had to get, instead of from Manila or from Luzon, they had to get from Cagayan de Oro, yung baboy nila. Siyempre may dagdagin sa logistics.
Tama.
Ano, nung Pasko, nagmahal lalo yung baboy. Ano naman yung saka nagrereklamo sila, yung smuggling daw, i-check din nyo dahil nami-misdeclare daw yung mga marami din silang sinasabing problema na kulang daw sa action yung gobyerno. Ano naman yung masasabi niyo doon?
Di naman, Ana Marie, yung sa smuggling naman, maliliit lang yan eh. Actually pero sa Bureau of Customs yan, wala sa puder namin. But then again, yung talagang nag-jack up ng prices, yung nung sa lechon, sila mismo nagpataas eh. Kumbaga, nagpagka-highest bidder sila eh. O akin na yan, 3 buwan pa lang, tinatawaran na eh. Sila na mismo nagpataas kasi malaki ang demand nung Pasko.
Asec, I think yung isang argument nila, because maganda po yung pagkakalagay nyo, no? Pagkakasabi nyo, dahil you see the human side to both sides of it. But what I think what some people are saying is that the intervention both on the supply side and also on the demand side, it basically ended up with the cure being worse than the disease.
No.
Their argument is that maybe market forces could have corrected itself in time. But ito po yung actually question ko. Is it possible that the market forces are broken precisely because of the quarantine conditions right now? Because if you're saying that there are other prices outside of Metro Manila that are more reasonable and closer to what should be reality, is it possible that the fact that actually I don't have a choice to go to Laguna, I don't have a choice to get my relative in Batangas to buy pork for me or so on, is it possible that the market forces around Metro Manila are broken right now because of quarantine conditions?
Yes, yung lockdowns, naka-contribute yan to answer you, Robbie. Talagang, yung restrictive, yan eh. Yung patong-patong na kuminsan, parang makalusot lang, di ba? Tumataas ang presyo niyan eh. May kanya-kanyang, tong. Pero, ganun pa man, ang ating sinasabi is, kung hinayaan natin yung 400 to 450, mas maraming masasaktan na consumers. Binabalanse lang natin ang interest, di ba? At napatunayan naman, maraming sumunod naman eh. Nakaya naman palang ibaba. Ngayon, ang going rate is 330, 350. Pero wala na yung 400, 450.
Pero marami rin pong nagpa-pork holiday ngayon. I mean, yun naman yung kabila doon, di ba?
Yes. Sa amin, gusto namin sila magbenta. Kung talagang wala pang maiparating, kami tumutulong pa rin. Ibig sabihin, next time around, kayo naman, babalansin bukas. Bukas na bukas.
Asec, sorry, medyo dense ako ng kaunti. I need to go back again to the earlier question. Kasi we talked about October, okay naman ang presyo until October came, and so on down the line. And October was almost a year after we got hit by ASF, 2019 yun eh. Di ba? So,
January.
In that case po, kung ganun, ano pa ba talaga? Do we have a problem with supply talaga, or is it a problem lang of price? Kasi, yun nga, I'll go back to that. We imported 62,000, I understand, heads to Metro Manila in 12 days, more or less, in 12 days. That's, and I understand na yung 4,000 heads per day ang consumption dati ng Metro Manila. So that should have met already the supply side. Pero ang sabi naman ng hog producers,
Kulang pa.
obsolete ata yung figures ng DA dahil 10,000 daw talaga per day ang consumption.
Tumataas.
Also, yung
Laki
farm gate
ng
daw po,
difference eh.
yung farm gate
Yeah.
daw po ng DA na sabi sa amin ni Secretary Dar, 171 national average yon per kilo. National average. Ang sabi naman ng
Yes.
pork producers ay nasa 220 to 230
Yes.
ang farm gate
Taas yun.
na average. So, hindi po nagtutugma. Yun nga po eh. So, it goes
Tama.
back to that eh. We were talking about supply and
Kasi
demand.
po-
Sa supply po lang ba, solve na tayo? O ano ba talaga? Medyo nalilito ako.
Hindi. Pag high-end, tama ka naman kasi tama sa analysis. Pag silang tinatanong, mataas. Pag kami, tama lang. 171 across the board, national. Okay? May 220 pero bandang malapit na rito. Mataas sa
Central
Central
Zone.
Luzon, Batangas.
Calabarzon.
area. Yes. Pag mababa naman, nasa 140, 160. Kaya nag-average yan 171. Huwag namang 220 to 240. Hindi yun ang average farm gate price. Okay? So, yan po. Yung mga datos na yan, yung 10,000 sinasabi nila ngayon na yun po ang requirement ng Metro Manila. Napakalaki po yun. 4,000 lang po ang huling namin. No? Based sa PSA, saka sa survey. Okay? Para sa kaalaman ng yung per capita consumption natin is 15 kilos for 110 million population. So, ano ibig sabihin 115 ng 15 kilos? About roughly 1 kilo a day, 1.1 a month. Di ba?
Oh.
So again, yung kung kukumputin mo yon, doon makikita na nagkakaroon ng artificial tumataas pag silang tinatanong. Pero ganun pa man, kulang talaga. What we're saying, kulang talaga.
Kasi sir, talagang araw-araw may palengke kaming napupuntahan na wala talagang supply, no?
Hindi naman namin pinagkakaila yun eh. Talagang hindi matapatan, no? Ang atin. Yung iba naman kasi, kagaya sinabi mo, yung destined for Metro Manila na dadivert sa Taytay, sa Antipolo, sa Bulacan, sa nearby. So hindi makakatanggap yun ng support. Yes. So dapat tutukan, dapat yung binigyan natin ng ayuda sa South Cotabato, papuntang NEPA Q-Mart yan, hindi yung papuntang Bulacan. Diba?
Sige na nga, mamamalengke na lang kami sa Pampanga.
Di ba? Hindi, nagkikwento kami ni Lucy kanina, buti na lang, may isang araw tayo ngayon na bawal ang baboy. Di ba? Kasi
Biyernes.
Abstinence.
Yes. At pinopromote natin, as always, maraming protein sources other than pork, of course. Chicken, fish.
Mahal din ang chicken, sir eh.
160.
Ibang episode pa yun.
Hindi, kaya nga nilagyan ng price cap.
Sige, magmunggo na lang tayo.
Pag-uusapan ng manok dito eh.
Ang pinakamurang protein source, itlog pa rin. Itlog.
Okay.
Okay.
Thank you.
Yeah.
Munggo.
Yes, sir. Sige po, Assistant Secretary Noel Reyes ng Agriculture Department. Maraming salamat po, Asec.
Maraming salamat.
Salamat po.
Asec.
Kami dapat ang magpasalamat para maliwanagan naman yung ibang mga tao nakikinig na yung mga datos na yan pinaglalaruan din no? So again, thank you Ed, Lucy, Robbie, and Anna Marie for this opportunity. On behalf of Secretary William Dar, Department of Agriculture, good evening po sa ating lahat.
Thank you po.
Thank you, sir.
We will just go into a break, so please stay with us.
Welcome back, the Chiefs here on One News. We're now in the final stage of our conversation. Now, joining us are Doctors Antonio and Leonila Dans of the Health Professionals Alliance Against COVID-19. Good evening, Doctors Dans. Doctors Dances.
Doctor's Dance.
Good evening po.
Dances. Okay. Okay, Dr. Dans, kayo na lang mag-determine kung sino yung tinanong ko doon, ha? But Dr. Dans, ang dami ko, I really don't know where to start. So, linista ko yung mga issues na ano, but there's Mon Tulfo admitting to having received the smuggled shots along with the PSG, along with cabinet members, at least one senator. There's government contemplating a return to MGCQ, although President Duterte has said na hindi, wala.
And don't forget the President asking for sample vaccines for his family.
Dami pa. Number 3, Sinovac is coming, but they said preferably not to be used for frontline workers. And then today, now, out of the Department of Labor naman, nurses for vaccines. There's this whole controversial proposal. It's being interpreted by the Nurses Association that yung deployment ban natin on nurses, there seems to be a suggestion na maybe we can loosen that in exchange for some vaccines. So, as the representatives of the Health Professionals Alliance, I boil it down to one question. Kamusta naman po kayo?
Madali ho sana yung trabaho namin. Pero pahirap ng pahirap.
Kala namin tapos ayos na.
Nakakapagod din po. Nakakapagod. Pero we are doing our work.
But I'm sure you welcome the decision of the president to hold off on the loosening up, right? Or do you? I mean,
Well, for the Healthcare Professional Alliance, it's for us semantic kasi what we call it. We can actually open up the economy in the setting of GCQ. Kasi if we open up in blocks na ECQ, MECQ, GCQ, MGCQ, the new normal, we're committed to make a lot of changes. No? Pero palagay ko we need to leave that concept and just think we can gradually evolve into a new normal, whatever we call the different phases. Yun nga yung problema namin. Whatever we call it, parang we're not evolving, di ba? We're not evolving into a new normal.
Not fast enough.
Not fast enough.
okay, what would that new normal look like to you? I mean, what is that? Setting aside nga the names for it or the labels, what would that look like
In our
exactly?
discussions, there are 3 cross-cutting strategies that define the new normal, how we do things. Our business, whether talking of education, religious ceremonies, non-essential activities like going to movies or shopping, 3 cross-cutting changes. Number one, yung
Travel, but wala. Travel yung nilulusin eh. Yeah, okay.
active transport as an option.
Okay.
Right? We've needed it for the past decades because of pollution and traffic. But now we need it more. Kasi biking and two-wheeled light vehicles and walking, these are the safest modes of transport that will not only control this pandemic but prevent future pandemics. And that's not happening fast enough. Hindi ho nagagamit yung funds sa bayanihan to allocated for that.
Yung second,
The
yung
second.
second one will be yung ating internet access, no? Yung parang akala natin hindi related, no? Pero actually cross-cutting yan across different fields, no? We need it for education, di ba? Kailangan mag-evolve na yung ating educational system na that will have remote access, di ba? Tapos kailangan i-restructure, gawing bago yung curriculum, and therefore we need a lot of online access. That's one. And then ating healthcare din, kailangan natin ng, di ba ngayon, telemedicine na. So, ang daming islands in the Philippines na not reached by our healthcare delivery. So, importante yan. So, and also businesses, how can we have, di ba? Ang dami natin ngayong online businesses.
New business opportunities
business
online.
opportunities, mga work from home, we need to make sure na that can be done. And hindi lamang yung those who can readily access. Dapat kay mahirap ka o mayaman, maganda na yung internet access
60% of the population have poor or no internet access. And all it's going to take is an executive order from the president na yun sa ang tagal-tagal na nun eh. Sana magawa na kasi it will open up so many opportunities for education, for business, and other things. Tapos just to complete, yung third is open space. No? Ibig sabihin, imbis na shopping in malls, putting up pedestrianized streets. Imbis nagpapasyal tayo sa mall and shop in closed areas, we can shop in the open, no? So, open marketplaces. Pag nakita niyo yung drive-thru sa, sa harap ng Santo Domingo Church, may parang market doon. Drive-thru market siya, you can buy your vegetables and your fruits without ever getting off from your car, no?
So even schools, di ba,
Even school
kailangan
can
i-restructure, gamitin natin yung mga open spaces.
Yeah, so yung three, whether you're talking of essential or non-essential activities, we think we need to evolve into a new normal. Ang biggest fear namin is emerging from this pandemic exactly the same Philippines, exactly the same as we were when we entered into it. That will prolong the pandemic and predispose us to the next.
Pero actually, yung pinag-uusapan ngayon yung returning to normal, yun yung hinihingi ng mga retailers today. Nag-issue sila ng statement, yung retailers, yung hotels, yung BPO. That is the kind of reopening that they are actually asking for. They want the MGCQ na ASAP, yun ang hinihingi nila dahil nga to revive their businesses. Kaya actually yun ang pinag-uusapan eh. Saka pinag-uusapan yung back to face-to-face. So medyo mawawala yung shift to to distance learning and less pressure to shift to yung online modes. So okay ba sa inyo yun na mas mabilis? Yun ang gusto nila. As quickly as possible daw, yun ang gusto ng business sector, to shift to east into MGCQ. Okay ba yun sa inyo?
Well, ang tawag namin doon, the close open mentality. We're either close or we're open. And that's, parang ang lungkot naman nun, hindi ba? From every disaster, sabi nila, a new world should emerge. Dito, we went through a one-year disaster and emerge from it the same way. So, parang we need to rethink how we do things. And we think the government should enable
And empower
the people so that a new world emerges from this, where it's safer and cleaner.
and prepare us for the kung sakaling magkaroon uli ng pandemic, no? And they're saying na talagang that's an eventuality, no? Because of the way we conduct ourselves, no? So kailangan hindi tayo yung sige, pwede na uli tayo dun sa yung MGCQ face to face just like before. Dapat kumari even restaurants, dapat medyo mag-isip na sila na dapat mas marami na yung alfresco. Dati na yung alfresco natin pang panigarilyo lang, di ba? Dapat ngayon more the structure of our
Dapat
restaurants.
ngayon yung naninigari.
But of course, I'm sure people will say, but those are long-term goals. And I'm sure the government will say, yes, of course, we're moving toward that. But in the immediate, in order to arrest the decline in the economy, we have to make these hard decisions, which is precisely that. Are we going to open up or not? And how much, if ever, we're going to open up?
They're not long-term, Luchi. There's so much low-lying fruit here. if the president signs the executive order liberalizing satellite access, internet service providers all over the country can access, dozens of low-lying, low orbit satellites that are near us and provide internet access to even the most far-flung area.
Sa mga islands, no, na
Oo,
hindi pwedeng lagyan ng cable.
Yung pop-up lanes use existing infrastructure. You just need to paint the bike lanes and put even temporary protection. And open space, alam nyo, they did that in New York so quickly. Yung
Times Square.
Kunwari, Times Square used to be a thoroughfare. They closed it. And it became a pedestrianized street filled with people
And
who...
the stores became more, di ba?
Akala ng businesses, their businesses will suffer. The business peaked because Times Square was turned into a pedestrianized street. And they're doing it in Europe, in Spain, ang daming plaza, hindi ba? It uses existing infrastructure. It takes political will, but I don't believe it takes a lot of time.
Doc, I'd like to seize on that to go back to, in a more serious tone, yung question ko kanina. Because it's sincere. We keep saying magkumustahan din tayo. It's good for our mental health as well. But if you could if you could check the mental health of our frontliners right now. On the one hand, you have the vaccines coming. There's light at the end of the tunnel, hopefully. On the other hand, there are still all of these different distractions. And in fairness also, I might add, to everything that you've mentioned, marami pong nag-i-initiate yan, both on national government and local government levels. But if you take everything into consideration, the hope, as well as all of these distractions na hindi mo alam bakit ba hindi mo tigil. Kumusta na po talaga? How if you would encapsulate your own emotions right now on behalf of the frontliners in our country, how are you doing right now?
We're tired, Ed. We are so tired.
Ang daming noise. Ang daming parang minsan gusto nga namin sabihin, pwede ba tahimik muna tayong lahat? Let's just focus on what yung ating gustong gawin, di ba? So, vaccination, yan. Tapos ang daming mga lumalabas na kung ano-ano na some of them are just fake news. No?
So much chaos going around, so much fake news, so much politics. Parang nakakapagod eh. And then, when there are policies that aggravate the situation for the frontline workers, when they see na people are, not, we always blame the people about not protecting themselves. Kami hindi, we blame policymakers for not enabling people to protect themselves. Ang daling sabihin mag-social distancing. Paano?
Pagbigay ng ayuda.
Transportation.
Transportation.
Traffic. How will you go distancing, hindi ba? So, that makes the fatigue even worse. So, but kami, we're elderly doctors. We cannot go to the hospitals, no? Malapit na kaming dalawa mag-retire. Next year, magre-retire na kami. We're government.
Speak for yourself.
Sige. Mauuna nga pala.
But can you picture that for us? For the younger, the next generation of doctors right now, I know you just said we can't actually go out ourselves. But what does it actually look like more than 1 year after COVID, coming into 1 year of our lockdown? What does it look like right now in the COVID hospitals in the Philippines?
There's less COVID actually.
Actually, kahit na kung ano pa mga sabihin nila, namimintas sila sa ating COVID response. If you really look at other countries na, if you look at the US, we're actually better off than UK, di ba?
Europe.
Although nag-vaccinate na sila ngayon, medyo magandang ang curve nila, sudden drop. Hindi pa nila kine-claim yan dahil sa vaccine. But, relatively, kumonti yung ating cases.
Kaya lang, dumadami yung deaths and cases from neglected illnesses because of COVID. Takot pumasok ang mga tao sa hospitals, takot magpatingin. And so tinitiis nila yung dati nilang kinokonsulta na. No? Yun nga kami, we practice telemedicine kasi elderly doctors na kami. The work has invaded our homes. Dati nakakapagbakasyon kami, ngayon hindi na. Every day,
Ang
umaga.
new normal nyo na yan.
Yan na yung normal namin.
Pero, pero surprisingly, yung mga young doctors, siguro mas resilient sila. They have kinda adapted, pero syempre marami pa rin nagkakaroon ng
May fear,
anxiety, ganyan.
may depression.
And then, ang kawawa yung aming mga new doctors kasi wala silang masyadong makitang cases kasi they're not really allowed to be in the clinics.
yung mga student.
Yes, yung residents. No? And, yes, yes.
Doc, so what about ano naman? What about how we show our appreciation of what doctors do? For example, just give you an example. Well, originally the frontliners, the medical frontliners were supposed to be the first in line dun sa priority list. Medyo nagbago ng kaunti yun. Pumasok yung donations for the military, tapos hindi lang po sa military, pero even their families are now going to be included. Yung mga babakuna ng mga sundalo, pati yung kanilang mga pamilya. Pero yung mga frontliners na medical medical field, hindi po kasama yung families nila. I don't mean to try to compare the two of them and pag-awayan sila, no. Pero at least when you look at these two examples, how do they make you feel in as far as how we give priority to what you do?
I think we should trust. We all trust. We put our trust in the process, Ed. The process is FDA authorizes a drug. The health
In an emergency
use authorization, dahil incomplete data. And when that's done, hindi pa tapos. There are 4 steps kasi that assure us that we get the best vaccine. The emergency use authorization by the FDA. The next is the recommendation by the Health Technology Assessment Council. Talagang we should all know what HTAC means because they will undertake a thorough, quick, comprehensive evaluation beyond what the FDA does. So they don't only authorize availability, they also authorize procurement of these vaccines. Mas mahirap yan, no? Very technical. The third step is merong prioritization and distribution by the Department of Health through the NITAG or the National Immunization Technical Advisory Group. The fourth step is distribution by the LGUs. May cold chain yan to make sure na pagdating sa atin, okay pa din.
effective pa yung vaccine. No?
And-
Doctors, feeling nyo naman na susunod yung process. Kasi merong mga, naman na may recent developments na mukhang,
Except for Mon Tulfo, ha?
mukhang na-bypass yung process.
Maraming sanggatang
For certain sectors.
So far, so
Kaya
good.
yun, wala naman kayo malaking reklamo doon.
Kasi yung
Kasi yung minention ni
Sinovac.
Oo, yung sa Sinovac.
Isa pa lang.
So na EUA pa lang siya nagbigyan pa lang siya ng authorization ng FDA.
First base pa lang yun.
First base pa lang yun. So ang gusto nga sana namin ng HPAC, yung Health Care Professional Alliance, is sana sundan natin yon. So after the EUA, dapat dadaan niya ng HTAC. Kaya lang sinasabi nila donation. So hindi po
Hindi
officially ipo-procure ng ating government, no? So doon nagkakaroon pa na kami ngayon ng discussions para nga we want to make sure na dadaan sa proseso and hindi magugulo yung ating priority
Hindi
list.
maunahan.
Oo. Yung sa FDA kasi sinabi nila baka hindi ganun kabisa yung ating yung vaccine na yan sa healthcare professionals. Hindi naman nila intention na okay, ibahin yung priority list. Ang basihan ng kanilang decision is the data that they have. On our side naman, hindi namin masabi okay ba o hindi kasi wala pang published paper, yung Sinovac, for their phase 3 study. So, even the HTAC, ang HTAC ang bilis kumilos, ha?
But you're saying po that because it's a donation, it exploits a loophole or basically gives it a workaround sa HTAC?
Ano pa lang, we're talking with DOH, we're talking with HTAC, we're talking with FDA, and I think there is now a general agreement na kahit donated yan, it should undergo an HTAC evaluation, which is the second step. So I think there's general agreement and we're happy and we hope that it really happens. Kasi kung hindi yan dumaan sa HTAC, parang who can be assured that it is a safe
Yeah, linawin ko na po, that's general agreement on the public health sector side. Not general agreement with the IATF, say.
We haven't talked to the IATF actually. We've talked to kasi yung sinasabi naming agencies natin, FDA, the HTAC, the NITAG, and then the LGUs, di ba? So we've talked to them, but not to IATF yet. So
We're expecting that this will be turned into a national policy to follow the prioritization.
yes, because
With the representations you are making. Kasi you're moving it through the FDA, di ba? Inaasahan na aakyat to sa IATF.
aakyat sa HTAC. Kasi ano to yung process na to, lalo na yung FDA and HTAC, that doesn't have to be approved by IATF. That's mandated by law.
Yeah, yeah. Yeah,
So-
that's really the process, right? So you're saying that even if it's a donation, it should go through the process.
Yeah.
That's your point. Yeah. Okay. We get that. But okay, on another subject, but vaccine related, how do you feel about the vaccine hesitancy? Is this a concern for you? The fact that a big number of Filipinos would rather not be vaccinated if the vaccines came now,
Yes.
which is not likely. But yeah.
One of our biggest concern now, no, yung vaccine hesitancy. Kaya nga yung HPAC, yung aming group, is making sure na everything, we promise na ipoprotect namin yung process para naman kampante yung mga Pilipino kung ano yung dadating sa kanilang vaccine will be a safe, sulit, at saka effective na vaccine. That includes the entire process, no? Hindi lang yung sa umpisa na nabigyan ng EUA, pero nakita ba yan, pati ng HTAC, maganda ba yan, yung priority ba natin, tama ba, no? So lahat na yon ay magagawa na hindi naman nadidelay. May isa kasi misconception tayo na akala ng mga kababayan natin at some of the politicians as well, na ang red tape ang nakaka-delay kaya wala pa tayong bakuna sa Pilipinas, no? Hindi naman totoo yun kasi yung ating FDA, hindi na nga natutulog yung mga yan sa kakatrabaho. Lahat ng data ine-evaluate nila.
Doc, sorry, babalik lang ng konti. Yung ano yung kaibahan ng FDA decision dun sa HTAC decision? Kasi I thought they were both talking about safety of the vaccines and efficacy. What's the difference between the two approvals?
So yung the first base, yung FDA, they assess mainly safety and a bit of efficacy of the vaccine, no?
So primarily
and then,
safety.
Second base, yung HTAC, goes into things like impact. Ano ba ang impact niyan sa atin? Kasi it affects not just the number of cases and deaths, it will also affect our economy, businesses, the incidence of hunger. They look into the legal aspects and the ethical and moral aspects, how it will affect the poor. So it's very technical. Alam nyo yung health technology assessment is at least a master's degree. In other countries, it's a PhD. Mabibilang natin sa dalawang kamay natin.
Okay.
Kaya niyan. Pero ang pinaka-importante, the HTAC is mandated by law to do an important thing. Protect itself from politics and financial interests, no? We've done our investigative work. We looked up the members. Wala kami talagang makitang conflicts of interest. Right now, you hear people talking about this and that vaccine and this is better or that is worse. They have to declare their conflicts of interest, but they're not, mandated to do that. HTAC is mandated by law to address that and manage conflicts of interest. So we put a lot of trust. Feel secure that they will make the right recommendation unaffected or uninfluenced by politics and commercial interests.
Okay.
Okay. Dr.
Alright.
Antonio and Leonila Dans of the Health Professionals Alliance Against COVID-19. Dr. Dances? Doctors Dance.
Okay,
Mali po
Dr.
rin.
Dan.
Anyway, Docs, maraming salamat po
Maraming
for joining
salamat
us
po.
tonight.
Thank you very
Maraming salamat to the dances.
Okay,
Yan.
salamat po.
Good evening.
Sige po.
Thank you po, ingat po.
Yung iba, dinideclare naman yung conflict of interest nila.
Oo, buti pa yung mga doktor.
Yung iba nga, inaamin yung conflict. Hindi.
No conflict nga daw.
Aminado naman siya.
Aminado naman.
Okay, that will be all for this Wednesday edition of The Chiefs. We hope that this discussion will keep the conversation going. I'm Ed Lingao.
I'm Ami Pamintuan of the Philippine Star.
I'm Lucy Cruz Valdez of News 5.
I'm Robbie Alampay, and we are One News.